It's a sad reality that ladies often face troubles when it comes to their health being accurately understood. Many times, they are either diagnosed incorrectly or led to think that their intricate health symptoms are merely psychological. What's even more alarming is that women often find themselves waiting longer than they should to get correct diagnoses for everyday health conditions. And when it comes to diagnosing chronic, complicated conditions, this delay can become even more severe. So, it's not just in your head, and you're not alone in this struggle. It's a genuine issue that needs attention and understanding. In this video, we will discuss the challenges that women with chronic conditions face and provide some tips for managing them effectively and living well. A persistent health issue, also known as a chronic disease or illness, is a medical condition that lasts for at least a year, necessitates continuous medical care, and may hamper daily routines and activities. In the United States, an increasing number of women in their reproductive years are grappling with these chronic health issues. This trend can be attributed to the rise in risk factors such as inadequate nutrition, sedentary lifestyle, obesity, and smoking, which make people more susceptible to chronic diseases. However, let's not forget the good news. Women with chronic health issues are still capable of experiencing healthy pregnancies and giving birth to healthy babies. Your body is naturally equipped to protect and nourish your baby during pregnancy. But if you're dealing with a chronic health issue, you may require some extra support from your healthcare team to manage your condition and any necessary medications before, during, and after your pregnancy. Here are some chronic conditions that affect women more commonly. Migraines. We all hate migraines, but unfortunately, they are more prevalent in women than men. Hormonal changes during menstruation and pregnancy can trigger migraines or make them worse for many women. It's important to work with your doctor to find a treatment plan that works best for you. Ever felt a pounding or sharp pain on one or both sides of your head? It's not just a regular headache. You might be dealing with migraines, a more severe form of headache that arises from the activation of nerves within your brain and the surrounding spinal cord area. What makes these migraines worse? Simple movements can amplify the pain, and it can make you more sensitive to light and sound, causing discomfort. Sometimes, these migraines come with an aura or changes to vision either during an attack or afterward. It's almost like your body's way of saying, hey, something's not right here. Every person may experience a migraine differently, in terms of symptoms, duration, and intensity. But according to the National Institutes of Health, NIH, some common symptoms to watch out for include a painful, persistent headache, increased sensitivity to light, sounds, and even smells, feeling nauseous, vomiting. It's important to note that migraines are not an everyone issue. They seem to have a liking for women, being 3.25 times more likely to occur in females, often linked to hormonal fluctuations that happen in their cycles. In fact, for women in the US, it's the fourth most common cause of disability. And that is a significant percentage, considering almost 39 million women experience migraines. Endometriosis. Another condition that affects women more commonly is endometriosis. This chronic condition occurs when the tissue that normally lines the inside of your uterus starts growing outside of it. This can cause intense pain during periods and even infertility in some cases. Unfortunately, due to a lack of awareness and research, this condition often goes undiagnosed or misdiagnosed for many years, causing immense frustration and suffering for many women. However, with proper management through medication, surgery, and lifestyle changes, women with endometriosis can greatly improve their quality of life and possibly increase their chances of becoming pregnant. Autoimmune diseases. Autoimmune diseases, where the body's immune system mistakenly attacks healthy cells, tissues, or organs, are also more prevalent in women. In fact, about 8% of the world's population suffers from an autoimmune disease, with women making up 78% of that number. Some common autoimmune diseases that affect women include lupus, rheumatoid arthritis, and multiple sclerosis. Managing these chronic conditions can be challenging as they often require lifelong treatment and monitoring. However, with early diagnosis and proper management through medication and lifestyle changes such as a nutritious diet and regular exercise, many women can successfully live well with these conditions. Rheumatoid arthritis. Here's a friendlier, more conversational approach to understanding rheumatoid arthritis. Picture this: an autoimmune disease that leads to inflammation in your joints. This isn't something that just affects the elderly, but it could happen to anyone at any age. When rheumatoid arthritis strikes, the lining of your joints gets inflamed. It's like a long-term unwanted guest that can cause lasting damage to how your joints are structured. And it usually targets joints in your hands, wrists, and knees. But how do you know if you have it? Let's look at what the experts at CDC identify as common symptoms to watch out for. Aching pain in more than one joint. Feeling stiff in more than one joint. More than one joint is tender and puffy. Identical symptoms appearing on both sides of your body, like both hands or even both knees. Unexplained weight loss. running a fever, constant tiredness or fatigue, persistent weakness. Did you know that rheumatoid arthritis is notably gender biased? It's 2 to 3 times more common in women. Astonishingly, women make up about 80% of individuals who are diagnosed with any autoimmune disease. Now comes the most important part. How can we manage and overcome something that's preventing us from leading a healthy life? First and foremost, it's essential to get an early diagnosis. This can help manage the symptoms and prevent any further damage. Working closely with your healthcare team is crucial in developing a personalized treatment plan that includes medication, physical therapy, and lifestyle changes. Don't let rheumatoid arthritis or any other chronic disease hold you back. Stay active with low-impact exercises like swimming or yoga, maintain a healthy weight to reduce stress on your joints, and prioritize self-care to manage pain and fatigue. Here are some tips for managing any chronic condition. Educate yourself about your condition and treatment options. Find a support group or community of others who are dealing with a similar condition. Communicate openly and regularly with your healthcare team. Practice self-care and prioritize rest when needed. Stay active in ways that work for you, whether it's walking, yoga, or dancing. Remember, even though chronic health issues may present unique challenges during pregnancy and beyond, women are strong and resilient creatures who are capable of overcoming these obstacles with proper support and care. So don't hesitate to seek help and prioritize your well-being as a woman because you deserve it. After all, our health is our greatest asset, and we should never neglect it. We hope you liked the video. Do not forget to subscribe to our channel for more informative content on health and wellness.